I think in our line of work, when we think about this, I like to think that having cancer is not funny, but funny stuff happens when you have cancer. Just because you have cancer, it doesn't mean life is completely serious from that point on. So to first talk about this, what do we think about, what is humor, right? Let's define humor just a little bit. And Merriam-Webster defines it as a funny or amusing quality. And the Association for Applied and Therapeutic Humor, which many of you may not have known that existed, but it does exist, and it's in Rockford, Illinois, of all places, it defines therapeutic humor as any intervention that promotes health and wellness by stimulating a playful discovery, expression, or appreciation of the absurdity or incongruity of life situations. And this intervention may enhance health or be used as a complementary treatment of illness to facilitate healing or coping, whether physical, emotional, cognitive, social, or spiritual. So yes, Rockford, Illinois does have a sense of humor. And where does humor come from? What are the theories of humor? And there, I've read a lot about this. There are really three prevailing theories of how humor arises. One is the incongruity or the surprise theory of humor, saying that humor arises when the mind suddenly encounters an unexpected outcome. And these are the sort of classic jokes, like a bear walks into a bar, the bear walks into a bar, says, "I want a beer and some peanuts." And the bartender says, "Why the long pause?" So it's that punchline that comes from a different aspect than you thought it was going to come from. That's the surprise theory of humor. It's also, if any of you are Seinfeld fans, like the end of Seinfeld, something always sort of came in that pulled it all together that you totally didn't expect. It was amazing. So the second is that humor actually originates from the repressed expression of sexual or aggressive feelings. And this is the theory of humor that Freud actually touted, and that was popular with Freud and other psychotherapists, and equates laughter. He says laughter actually releases the psychic tension that's related to inhibiting unconscious sexual or aggressive tendencies. And then the last one is the superiority theory, which is that humor is used to elevate the social status of the user by making fun of the other person. Believe it or not, and you see this actually, I always think of the old Monty Python skit where you've got the knights at the top and the folks are trying to get into the castle, and he says, I hurl insults in your general direction, or actually I think he says I fart in your general direction. But at any rate, that's kind of the scene I have in mind when I think of this. But actually this goes back even further. The Greenland Inuit, when they would have actual disagreements, and if those disagreements escalated, they actually have this thing where they sing songs at one another in a huge public forum. They will face off and sing songs about the other one and try to make the other person laugh, and whoever laughs first actually loses the argument. So, and they're funny songs, and they make fun of people as they do it. So that superiority theory of humor goes back even further than that. So to discuss some of the science regarding humor, I think we'd be remiss not to mention Norman Cousins. Norman Cousins was the first to really direct attention to the healing powers of laughter. He was the editor of the Saturday Review for many years and was diagnosed with ankylosing spondylitis. And he wrote a book called Anatomy of an Illness about how he used laughter to help him cope with the pain of that illness. He made the quote here that, "I made the joyous discovery that 10 minutes of genuine belly laughter had an anesthetic effect and would give me at least 2 hours of pain-free sleep." He talks a lot about the use of laughter in this book, and this was one of the first books that really devoted a lot of attention, in the lay press at least, and some science, to the use of laughter. And his method of inducing laughter was Three Stooges movies that he would watch and laugh at. So some of these studies we're going to talk about use different ways of inducing humor, which I also think are kind of fun to look at. This cartoon goes over better usually with this group than it does the cancer groups I give this talk to, who just look at each other. But as I mentioned earlier, stress is obviously a hallmark of a cancer diagnosis. And if we look at some of the science behind stress and cancer, we see that Norton and colleagues found that 55% of women who were diagnosed with ovarian cancer scored as distressed on an impact of event scale. And whether or not humor actually can help stress is, again, a huge question. And Mary Bennett, whose research I will quote a couple times today, is a nurse at Indiana State University and has done a lot of work on humor. She's written quite a few series of papers on the use of humor in medicine. She actually interviewed women with breast cancer and found that 50% of rural Midwest women, actually, to be honest, because this is around us. Indiana State is in Terre Haute, Indiana, and there's a lot of rural area in the southwest of Indiana. But 50% of women reported using humor as a coping mechanism when they had breast cancer. We'll talk about some data that we have in a bit from ovarian cancer patients as well. In a follow-up study by Mary Bennett and some other nursing colleagues at Indiana State, they tried to see if laughter could decrease self-reported stress in 33 healthy adult women. So they took 33 healthy adult women and they randomized them to watch either a humorous video or just a distraction video that was not funny. And women had the choice between watching a Bill Cosby video, a Tim Allen video, or a Robin Williams video. Interestingly, at that point, most of them chose the Bill Cosby video. I'm sure that would be different today. And women in the humorous group actually reported lower stress scores after watching the humorous video than did the women who watched just a distraction video. And the amount of mirthful laughter, if you look at the literature on this subject, you'll see a lot about mirthful laughter. And all that means is laughter that comes after a humorous stimulus, not just laughter that you generate de novo. So mirthful laughter correlated on this graph that you can see with post-intervention stress measures for women in the humor group. So you can see that the stress levels come down the more that you laugh. So what about humor and mood? Obviously, another consequence of a cancer diagnosis is negative emotion. And it seems plausible that humor may improve negative emotion in patients suffering from cancer. And there are some studies we'll look at to see how that plays out. One of the best studies done, actually, a small study by Lebowitz and colleagues at The Ohio State University, studied the effect of humor in a group of 22 patients who had COPD. And they were randomly assigned to watch, again, either a Bill Cosby video, and Bill Cosby shows up a lot in these studies, probably not in the future, an Abbott and Costello video, or a Funniest Home Videos video. So that's the other thing you see a lot of times. They'll have people watch Funniest Home Videos, because nothing's as funny as getting a ball to the groin or something, because that's all those shows are. Anyway, the subjects in the humor intervention actually had significantly improved positive affect, as measured by the positive and negative affect scale, or the PANAS scale, following the humorous video. But interestingly, in this study, they said that laughing aloud may cause acute deterioration in pulmonary function. So they recommended at the end of the study, maybe not the best group of patients to study humor in. But nonetheless, a positive effect in mood for these patients. An additional study by Strick and colleagues at Rabdo University in the Netherlands, they conducted a study of 90 participants, and the subjects viewed a neutral, mildly negative, and strongly negative picture, and then that was followed by either a humorous picture, so think of like a cartoon or something, or a positive picture that wasn't humorous, so maybe a serene picture of a tree or a garden or something like that. And they found that participants who viewed the humorous stimulus actually had less negative feelings than those who viewed the non-humorous stimulus. And so essentially humor attenuated the negative emotion associated with the negative picture better than just a picture of a tree or a garden or something like that. And they concluded that humor can actually attenuate negative emotions as a result of a cognitive distraction more than another type of distraction. So this, coming from Spiceland, Indiana, this is exactly what my parents thought happened in medical school. So where do they treat you to write illegibly was a big thing. This will mean nothing to the physicians of the future because of the electronic medical record, but there was a real concern that I would no longer be able to write after I had gone to medical school. But communication is really important. As I mentioned earlier, communication in a cancer setting, not only is it important for doctors to be able to communicate with their patients well, but the patient has to be able to communicate their illness to the rest of their family and community. In a review of the importance of humor in family medicine, Winder argued that humor actually narrowed interpersonal gaps, communicated caring, and relieved anxiety associated with the visit. And in a population of family medicine patients, Gross and colleagues found that patients stated that they felt less rushed if their doctor spent even a short amount of time talking about something else other than their medical visit during the visit. The residents in my clinic often will look at me and say, like, so how do I document that? We just talked about the Packers for 20 minutes. That's okay. Although my scores on timeliness are not that great, so maybe we should do this study over. In further testament, though, to the role that humor may play in communication, there was a great study out of California where they looked at 124 different physician offices, and they tried to figure out the components of physicians that actually allowed, or that had them be sued less. So which patients actually had less malpractice suits brought against them. And they found that if the patient used humor, they were sued about half as often as patients who didn't. So I think a real testament to how strongly humor is a communication tool with patients. I mentioned immune function earlier, and there have been quite a few studies looking at humor and immune function. In the previously mentioned study that I mentioned with Mary Bennett using the 33 Midwestern women watching humorous videos where we saw their stress levels decline, she also measured natural killer cell activity after the humorous intervention. And as you can see from the graph, the more you laughed, the higher your NK cell activity. And there was another study out of Japan from Osaka University that took 21 young male patients, and they randomized them to watch either a comic film of Japanese stand-up comedians or a non-emotional documentary, and they randomized the order that they watched them in. And they found that natural killer cell activity increased after watching the humorous film, but there was no change after watching the non-emotional film. They also found in that study that the comedic film could decrease the scores of tension, anxiety, depression, or anger, hostility. And then Lee Burke and colleagues from Loma Linda University in 2001 published a study of 52 healthy men who viewed a humorous video. They got to pre-select the video, and astoundingly, they mostly chose the Gallagher video. So they watched a guy smashing watermelons for an hour. And they found significant increases in natural killer cell activity, as well as elevations in IgG and IgM. And some of those elevations lasted up to 12 hours after watching the humorous movie, compared to folks who watched a non-humorous movie. And interestingly, their group previously had published a look at stress hormone levels in patients watching comedic films, and found significant decreases in cortisol, growth hormone, and epinephrine following mirthful laughter. So there's growing evidence that laughter and humor may actually positively affect the immune system. Unfortunately, as we all know, pain is a common finding in patients with cancer, and certainly at some point, whether it's from the anti-cancer treatments or cancer itself, women are dealing with pain with their diagnosis. And Weisenberg from Bar Ilan University in Israel studied 80 volunteer subjects. This is one of the more interesting studies I found about humor, to test pain tolerance while viewing different types of movies. So they randomized these volunteers, and they had them in groups to watch repulsive films, neutral films, or humorous films. They first had them sit with their elbow in an ice bucket, and they measured how long they could tolerate having their elbow in an ice bucket, let them fully recover, and then they had them do it while they were watching either a repulsive film, and this was mainly a horror film, a comedy, or a neutral film, or a documentary. And they found actually that, as you can see from the bar on the bottom red bar, people who watched the repulsive or humorous film were able to keep their hand in the ice bucket much longer before they realized that it was hurting them and they had to take it out. The repulsive film, actually, they were able to keep it in there longer. And they concluded from this study that humor was probably acting more as a distractor, and that any type of distractor could increase pain tolerance. And then another actually really interesting study, and this comes from, and I didn't make this up, a group of researchers named Rotten and Schatz from Florida International University. In addition to their publications on dysentery, they did some studies on humor, my goodness. But anyway, they randomized 78 patients after orthopedic surgery to watch either a humorous film or a non-humorous control movie. When they were post-op from orthopedic surgery. And they found that on post-op day 2, pain scale ratings were less for those who watched the humorous movie compared to the control movie. A really interesting aspect of this study is that they actually let people choose the humorous movie that they got to watch. And they gave them a choice more than just a couple of different movies. And as you can see from this graph, the patients who actually chose the humorous movie fared better than those who didn't get a choice. And this really piqued the interest in the thought that your humor style may actually have quite a bit of difference in how your pain tolerance and how you react to these films, which makes sense. If mirthful laughter, as we saw in the Mary Bennett study, actually increases or decreases stress and increases immune function, if you're watching Abbott and Costello or the Three Stooges, yet you hate slapstick, you may not get much out of that. Being from Indiana and going to college a couple of blocks from where Kurt Vonnegut grew up, you can't help but be a huge Kurt Vonnegut fan, but one of the great quotes, I think, from Vonnegut. But a few years ago, the PA that I worked with brought up to me how often I used humor with my patients in the clinic, and how often she had heard from those patients sort of outside that visit that they really appreciated that. And it's not anything I'd really thought about. It's actually something that I can't control often. As residents can attest to, I'm often unable to not say what's on my mind. And but it became something that I was interested in, and I spent a little bit of time thinking about it. And obviously we don't deal with patients who are always having the best of days. And what I really became interested in is it possible to use humor in a way that might be beneficial to women in our population who are dealing with really significant issues. So in an effort to try to figure that out, we performed a small descriptive study a few years ago to really better understand how women with recurrent ovarian cancer, and I chose recurrent ovarian cancer because it is a terminal illness, and most of these patients at one point or another had been told that that was a terminal illness. And I wanted to see how they thought about humor, number one, in their daily lives, at home, with their family, with their friends, but also how they thought about it in the context of the medical visit. Did their doctor ever use humor while they were in the room, and did they appreciate it, or were they offended by it? So we performed a phenomenological study, and that's a study basically where you try to understand the phenomenon from the patient's standpoint. So we did in-depth interviews with patients. And the way that you cap recruitment to a phenomenological study is when you stop getting new information. So we did 17 in-depth interviews with women with recurrent ovarian cancer. They were structured interviews. We asked a lot of the same questions to make sure that we had answers to some very specific questions that we had, but we also allowed them to tell us whatever they wanted to about the topic. A couple of the questions that we asked of everybody, for instance, were, do you use humor as a coping mechanism? How did you feel? If your doctor used humor, how did you feel about it? And in what settings do you feel humor used would be most appropriate? So what we found is that 82% of the women reported using humor to cope with their illness, even more than in the Mary Bennett study of breast cancer patients. And 76% of the patients actually felt that humor helped alleviate their anxiety. Again, totally subjective question, but important. And all of the patients felt that a physician or caregiver using humor would be a positive thing. So again, 100% of the patients said, if your doctor used humor during your visit, how would you feel about it? And they all said, I would feel okay with that. And most women felt that the best time for a humorous intervention, we heard over and over again that waiting, especially during chemotherapy days, was the most stressful time for them. So I want to share a few of the quotes with you. And these are direct quotes from the patients. So doctors' use of humor depends on the context. It would have to be somebody who I already knew pretty well, and how they used it might make me feel uncomfortable, but I think it also depends on how well you know somebody. You hurry up and wait here a lot, the whole waiting room in the chemo area. It's very hard to be there because you see people in all stages of their treatment. Some of them don't look very good, and you can tell the people that are just beginning their treatment. Humor takes your mind off of yourself, and I feel better when I've laughed. I think it would be fun. Another one said, when she was sort of talking about to describe a potential time when someone used humor, there was a humorous story about a dog. A nurse had a dog from the pound, and our dog was a rescue too, so we had things to talk about, shared special stories about dogs. Just the fact that she had a dog that she loved very much, and it was a rescue. And then the last one here, I think is more powerful even. There's something that cuts through the power relationship too if you can use humor. Self-deprecating humor, I think, is also helpful. And yeah, I think people who are funny are just more fun to be around, so that's my experience in life. And as John Cleese said, a wonderful thing about true laughter is that it just destroys any kind of system of dividing people. And I think that's what that patient was speaking to. So we were able to group what we got from these interviews into some significant statements. Statements that really grouped around common themes. So we took a bunch of statements and we really pulled them into 4 common themes of how our patients viewed humor. And those were that humor was perceived positively by all patients. They did feel that a relationship with a doctor is often felt necessary prior to the use of humor. So when you first meet somebody you don't know that patient, maybe it's not as well received. And that humor is subjective and not always a joke, as you saw from the quote, a story about a dog. You may not think that you're using humor with a patient, but in fact the patient views that in that way. And that waiting periods during visits and treatments are difficult and anxiety-provoking. And this made a lot of sense. Not what I expected to hear, but if you can imagine waiting in the lab, waiting on the doctor, waiting for the medicine, waiting for the pharmacist. It's a long day. So, and one of the things, actually I'm going to go back for a minute. One of the things that I thought was interesting about that humor is subjective and not always a joke. I talked about the study earlier where patients felt less rushed during their family medicine visits if the doctor talked about anything other than their medical visit during that visit. And I think that goes back to the communication piece. So patients really feel like they connect on a different level if you talk about something besides what they're there for that day. So when we analyzed all this information, it became clear that if we were going to use an intervention in humor as an intervention, that the place to do it would be during their chemotherapy visit. So we started with the help of Ryan Spencer. We started a study in 2014 called The Effects of Immediate Diversion on Quality of Life in Patients Receiving Chemotherapy for Recurrent Gynecologic Cancer. We included any recurrent GYN cancer in these patients. Excuse me. And the idea was to try to analyze whether humor or any sort of distraction might be playing a role in improving mood in these patients. So the primary outcome was mood, as measured by the positive and negative affect scale. Patients filled these scales out after cycle 1, and then they were able to actually watch a humorous video, which we gave them different choices for, or a non-humorous video, which was mainly a documentary, and we measured their mood after each one. Some of our secondary endpoints is that we had all of our patients fill out a health styles questionnaire form to get a sense of what their health style or humor style was. Excuse me, not health style, but humor style questionnaire form. Brief fatigue index. We wanted to see how easy it was to actually use this iPad that we loaded with movies, and how patients felt about the quality of the materials. We recruited, actually, this is an older slide, we recruited 66 patients for this study, 33 in each arm for an 80% power to detect the effect size that we wanted. We also, one of the interesting aspects of this studies is Ryan sought out a PhD in film studies here at the University of Wisconsin, who actually currently is at Colorado State University, named Nick Marks, who really helped us try to make sure that we had plenty of films to choose from, that everybody would find something that interested them. So we would hit all the genres that would be interesting to different people. And here were the movie options. So in the humorous, you see some dark humor with 50/50. I don't know if you've seen that movie. It's a movie about a young man who gets cancer. But it's got Seth Rogen, so it's funny, as you might imagine. Some slapstick with Airplane, Annie Hall, Mrs. Doubtfire. Kind of gives you a smattering of different genres of humor. And then the non-humorous films were really primarily documentaries, but we tried to hit different things and different topics so that people would find something they might be interested in. So we have things like Menopause in an Hour, which sounds awesome, and Titans of Yoga, which I think is great. So, but right now we have just completed accrual to this study, and Ryan and I are sort of in the phases of analyzing the data. So, and we're hopeful to have the results out by the end of the year.
You mentioned Bridesmaids was the most often watched humorous movie, especially by the older demographic.
Yeah, love it. Wonder if they turned that off early. That was pretty rough.
Watched the whole thing.
I love that. They fall asleep during it.
So by now you're sitting in your seats and saying, okay, yeah, this is great, but what does this mean for me and my patients, and how can I possibly use humor? Oh, this is my favorite. So let's talk a little bit about when we can use humor and when we shouldn't use humor. And first off, there are situations where humor really should not be used with patients. Emerson from the University of California at Berkeley published a paper saying that there were 3 specific instances where humor did not occur in the hospital, and this was an observational kind of study. And the first was when patients are threatening not to cooperate with staff. The second one is when patients are extremely upset. And the third is when staff are interacting with the relatives or visitors of dying patients. That all makes pretty good sense to me. But I would add a couple more on there that I think I've learned over the years. And that is, number one, when patients are defensive or angry, which we see at times in the cancer clinic, and when a joke is at a patient's expense. So 2 things to never do. And as I mentioned earlier, I'm somebody who has a really tough time passing up the opportunity to say something that might get a laugh. And I've used that to my detriment at times. And I'll never forget one patient in particular that I learned a vital lesson on, and that was a young woman who had ovarian cancer, who we had operated on, getting chemotherapy. She was probably 3 cycles into chemotherapy and having a tough time with her diagnosis. She was struggling with a lot of the things people struggle with, but more so than most. We had sent her to the cancer psychologist a couple of different times. But every time she would come in to see me, she was really depressed, really sort of angry and defensive. And at that point I was looking for some sort of inroad to try to, because things at that point at least had been going fairly well for her. And I was trying to try to help her feel just a little bit better. And she was talking about hair loss and how devastating that was for her, and something she and I had talked about before. And I just sort of said, well, you can do what I do and justify some extravagant expense with all the money you're saving on hair products. Totally didn't go over. And knew right away. She kind of shut down, never came to see me again. So I thought I was making a self-deprecating remark about myself. I think she felt that it was at her expense a bit. And I learned a lesson there, right? I mean, she was not ready for humor. That's when patients are defensive or angry. Why I added that one. And something I've never done again. So I think there are things you can say that will actually distance you from your patients, and you have to be careful about that. So when is humor appropriate? And Lieber actually described a couple of different things. Timing, receptiveness, and content are all really important for appropriateness. But I would also add that trust must be established, and there has to be a mutual understanding of the therapeutic goals between the patient and the doctor. So and again, you can take this into any aspect of medicine, but just from our aspect of medicine, when patients have a vastly different idea of where they're headed in their treatment compared to where we think they're headed, you really have to be on the same page with your patient to be able to use humor. And then this concept of timing, receptiveness, and content, Lieber went on to write that humor really had no place at the height of a crisis, but it really worked well once the crisis had dissipated in being able to deal with that crisis. And maybe you guys have experiences. I know I have experiences, particularly in the ICU, where when the crap's hitting the fan, it's no time to joke around. But sometimes when things are calming down, it's okay to use humor to kind of deal with that. And one of the most well-developed models of the use of humor, especially in the palliative care setting, and you may think that that's amazing that we can use humor in the palliative care setting, was set forth by Manuel Barad at McGill University in Montreal. And he proposed something called the SMILES method. And that's basically S stands for smile. So, a lot of times with palliative care patients, excuse me, my voice is getting rough. When you walk in, it's everybody is very serious, and you tend to make that a serious visit. But it's okay to smile. The M stands for make eye contact, not to look away, to really try to engage with the patient. The I stands for intuition and imagination. So try to imagine and use your intuition to find out what common ground you might have with that patient and how you might be able to bring in some lighthearted moments. Again, it does not have to be a joke. The L is to look for, listen to, and leap at the opportunity to bring that lighthearted conversation into that visit. And the E stands for elephants never forget. So, ask your patients what they do for a living. Ask them about their kids. Ask them about their hobbies. I have a patient who works at Land's End here in Wisconsin, and every time she comes in, she has some great stories about Land's End and some of the weird things that happen at a clothing company. And be sensitive to the situation. Again, there may be times when humor is not appropriate at all. You do not have to use humor, but it may actually really deepen your communication with your patients if you use it at the right opportunity. So, what does that look like in practice? I think it can look like a couple of different things, and probably my most recent example, I had a patient referred to me from one of my good friends at Iowa, Mike Goodhart, who some of you actually may know, but she is this lady with a really horrible vulvar cancer that had been resected multiple times, had radiation, also a lot of medical comorbidities, and came to see me for a second opinion. And Goodhart had called and said, hey, would you see her? And after I kind of, gave him a bunch of crap about it, I said, sure. And so when she comes to see me, the first thing her husband says is, you look just like Dr. Goodhart. Are you guys brothers? And Mike Goodhart is also a bald, bespectacled white man. So, people say that a lot. But, and in that conversation, so this lady had a really difficult issue. Couldn't walk because of the size of this recurrent vulvar tumor, lots of other problems, and really, unfortunately, no great options for this patient. And so, after a really long, conversation with really no room for humor, and them not really getting an answer that they wanted, I noticed though that they kind of lightened up sort of at the end of that visit, like that confirmation of a second opinion saying the same thing someone else said, realizing that they were kind of where they were, they began to feel a little bit better. And so as they were walking out the door, I just took the opportunity and I said, by the way, I'd like to think I'm just a little better looking than Mike Goodhart. And again, wasn't expecting much, but just a visit that could have ended with some really serious sadness, ended with a chuckle and a handshake and a bit of a smile. And you can argue maybe that's for me, and I get that. But I also think it really helps communicate with patients at times, even in tense situations. So there are a couple, I don't know if any of you have seen the movie Funny People with Adam Sandler. There are a couple of video clips from that movie that I think really hit home a couple of the topics we've talked about today. I'm really not getting emotional. But this is a movie. Adam Sandler plays a stand-up comedian who gets diagnosed with a really rare cancer. He's on a clinical trial and being treated for his cancer. And in the first clip, he is actually getting some bad news from his physician, and he tries to incorporate some humor. And as we'll see, the doctor is completely incapable of being able to sort of run with it or kind of give him a little bit back. He just kind of shuts it down. And then in the second scene, we'll see him do it a little bit better. So.
Please put away this video game. Don't do that. Don't be rude. Fucking playing Centipede? What the fuck are you playing? Just a driving game. Hello, Mr. Smith. Happy to see you. How are you? I brought my friend. I was playing ball. I love her. My life partner and everything. Boy, what's going on? How are we doing?
Well, your immune system is in the middle of a very serious battle. The medicine is trying to combat the disease, but in the process it destroys healthy tissue and disrupts healthy functioning of your organs and multiple lymphatic systems. So you're getting attacked on 2 levels. And we hope the disease is vanquished before it and the medicine does damage which cannot be contained.
Your accent's very thick. You ever notice your accent makes things sound worse than they You get good news, I still do that. What happened? You still dying?
I'm just trying to help you.
I know you sound like a regular Joe where you come from, but here, I can hear me torturing James Bond later.
I'm sure your sense of humor will serve you well in this situation.
There he goes again. All so terrifying because it came out of your mouth.
You are a very funny man.
Are you mad that you died at the end of Die Hard? I want to post you guys in the second picture.
I assure you I was not in the Matrix.
What did he do?
If you have no other questions, I do have other patients.
You have other patients that you have to frighten by the end of the day? How many patients do you frighten a day?
And I'm slowly getting a little bit annoyed by this humorous activities from you guys. So I think we have discussed this, and I'm very, very sympathetic to your recovery, and I hope we will succeed with what we're doing.
I've been trying to build this cabinet I bought from you guys for like 6 months.
So, again, I mean, the doctor says all the right things, but he could have just sort of taken that a little bit and taken some of the ribbing and gone with it. The next example occurs at the end of the movie, and admittedly it's when Adam Sandler's character is getting good news. But I think it emphasizes a few points. So I want you to notice how the doctor here uses his memory from this encounter you just saw and brings that, incorporates that in as he uses some humor to interact with Adam Sandler's character here.
Every time I'm near you, I feel like fucking Danny DeVito.
Everybody feels like when
You're a giant.
I don't want to get your hopes up. We put you on this experimental medication without much optimism. About 8% of all the people that we put on this medication get positive results. You actually belong to these 8%. I looked through your blood work and I couldn't find any traces of the disease. I don't want to speak too soon, but we may have beaten this thing.
Are you fucking with me? Because I fuck with you?
So that's the good news, Mr. Bond.
So this is good news?
Like my accent now?
Now I like your accent.
I was excited all morning to tell you this news.
What happened now? What do I do now?
Maybe you can make another funny movie that I could laugh about.
Yeah. Well, I wasn't expecting this to really work. I was getting used to being sick. I was actually thinking I was pretty good at that.
Get back to your life.
So a good example of how you can draw that memory in and use some humor with patients. In conclusion, I hope we've provided some evidence for you that humor may actually decrease stress, improve mood, improve communication, improve immune function, and possibly decrease pain. And we've given you a little bit of acronym SMILES that you can use to help incorporate humor into your patient interactions. So I want to thank everybody for your attention today. Happy to take any questions. Questions? Yeah.
I know this wasn't really a general science talk, but I was wondering if you have any information about maybe some neurotransmitters or other types of molecules that are increased when
The best studies about laughter and humor you just saw. Yeah, so these are the best that are out there. So there's really not a lot. There's more subjective, more small studies, but there's a lot of work to be done to try to flesh out what it might be doing. Yeah, Dave.
Just to follow on that, are there plans that you have to look into some of that, considering our lab and what Tinker is doing? Is there a way to pull that together? Is that a plan of yours?
Absolutely, yeah. So the results of the first study we just completed, we are hoping will allow us to, apply for some grant money to look into some of the actual basic science correlates with this kind of work. Yeah. Ellen.
Is there any way to kind of, obviously there's this humor styles inventory, but is there any way to try and figure out like who has a sense of humor and who doesn't, and how to get one for someone? My daughter's very serious and came up in preschool and,
Yeah, that's a great question. There is a lot. There's actually a lot of behavioral research into humor and who's humorous, who's not, and there are people who are not humorous, and that's okay. There's nothing wrong with that. But yeah, as far as to how you make someone have a sense of humor, I don't know about that. Yeah.
how you help.
Yeah, Katie.
I didn't notice any studies on humor with labor pain. Did you come across any of those?
I have not paid much attention to the labor aspect. I've really spent more time working on cancer and some of those functions. But I've not, actually that's an interesting question, I've not looked at that. Yeah. Yeah.
Is there any studies looking at gender of the physician and use of humor? Because I think sometimes women are perceived very differently. I just wonder if there's
Nothing I've come across. There again in the behavioral literature there may be more of that. Good question as to who is more, would you be more receptive to humor, female doctor to female patient versus male to female patient? Good question. Yeah.
Is there anything about if humor, if you're supposed to get a certain amount a day, what environments you get your humor in, or if you do it during chemotherapy versus if they do that at home on their own time or they're with their family, or what kind of environment is the most effective?
Nothing out there about what's most effective. So most of the studies that have been done that have used humor as an intervention, as you saw, were really done in an institutional setting. So where you recruit either, actually most of the recruits are just volunteers. And they come in and actually view it in a room and more of a controlled environment. So there's not a lot of data out there to suggest that one place is better than another, because that's kind of what we have so far. Yeah.
What about, I know we have a lot of different support groups through the Carbone Cancer Center, but has there been anything where we could bring in a stand-up comedian or doing something for groups of people to get together and laugh, not just with their doctor, but actually in
Yeah, there are a lot of, actually, this is not new, right? The name I didn't mention is Patch Adams, who did a lot of work with humor, but not a lot of scientific work with humor. There used to be something called the Chuckle Channel. I don't know if that still happens at UW, but there was actually a channel that was all comedy in the hospital. And there are, obviously people do use opportunities for survivors to maybe not, have stand-up comedians, although in Milwaukee I know that the Wisconsin Ovarian Cancer Alliance does a stand-up comedy kind of themed night. But there's not, they use comedy all over, but certainly not in a therapeutic way like that. Yeah. Yeah, Igor.
So Steve, there's a lot of data about meditation, mindfulness, and how that affects everything. And it seems to be like people who benefit from humor are those who are at that portion of their disease that have accepted that they have it, and they're willing to somewhat laugh about it. Have you noticed that there's a difference in who gets to that level first or not? You have this patient that went through 3 cycles, and obviously she's not yet at a point where she feels comfortable talking about this. And you probably have other ones that right after surgery are, we see it all the time with field information.
Yeah.
Parents who, 40 minutes after the storm, they are sort of ready to move along and be fine, and there are others who, 5 years after, they're not. And that has to do a lot with how they see and they perceive their life. So people who are more mindful tend to, take a time and then decide, okay, we're here and we're going to do this or not.
Yeah, that's a great question. I mean, I think it speaks to the fact that, and I'll be honest, I'm not sure if I completely believe that, because I do think humor is not only could it be therapeutic, it's also a coping mechanism. So even people who may not be as far along that sort of line where they're accepting have used humor in the past to cope with a new diagnosis. So some people you see will joke about things long before they're ready to have some peace with it. So humor kind of covers that span. So yeah, I mean, I think there are multiple opportunities for the use of it along the spectrum of disease diagnosis and recovery. Yeah, Alex.
So it's really fascinating. Narya, there's one study out there in Israel where they showed that if they hire a medical clown,
yes, I've read that study.
Their tax rates are better. So it's a big question.
No, yeah, it's true.
Is Laurel going to buy us all big red noses? Can we do that?
Yeah.
And then B, honey badger, something. And then B, it's interesting to think about humor from the concept of, it's a means of sort of rebelling and taking control, in a sense. Because a lot of, who we are as humans and how we perceive everything around us has to do with our ability to sort of model the mind processes of others, right? That's sort of the idea of empathy. And humor, in a sense, is sort of like essentially asserting control over that. Do you think that has to do with the whole concept of just agency and that humor buys you that?
I wouldn't even begin to know if that's true or not. I think there's certainly a piece of coping, right, and using that ability to gain back some control for sure. But the funny thing about that I've learned after researching this quite a bit is that the role of humor, there's therapeutic humor, which we're talking about in our study, but there's also just humor in the sense of talking to your patients and communication. There's humor in the sense of alleviating pain. I mean, there's so many different aspects that you could begin to investigate here. But whether or not you exert more control over the people around you, I think is tough for me to answer. Yeah. Thank you guys for your attention. I appreciate it.